No, I'm not going to tell you when we do. I said we're going to go live. I'm going to click go live, and then we're just going to quote go for it.
It said you're live.
No, but I know every video begins with someone saying, "Are we?" I think there's a button that says go live. We're professionals, and when it starts, we're just going to rip right into it.
Look at that! Right off the bat, they like your hair.
What? Sydney did this actually.
I did. I've been learning how to cut hair.
She cut my hair.
I'm pleased with it. We were going for a David Lynch.
Yeah, hold on, wait. Let me lynch it up a little bit.
We need some mousse to give him some poof.
Oh. This is my David Lynch version.
Do it again. You want to do it?
Let me get it bigger.
Need it bigger.
See this hair.
The fade. This is also supposed to be shorter.
Yeah.
But I was nervous. I was nervous about going all the way with that.
Yeah.
We've been doing a lot of weird hair stuff.
Yeah, because it's, I don't know, 2020. What else are you going to do?
Riley dyed my hair this color, red, pink. I've never done anything like this, but I'm not going anywhere right now. So Charlie was very excited. Her hair is blue and purple and pink. It's all temporary. It all washes out.
Yeah.
In case you're thinking, why would you let your 5-year-old do that?
Let me go ahead and do this. I'll make sure, get your introduction going. I'll make sure we completed.
Even with my glasses on, it's so hard for me to see.
I don't know if I can embiggen
the chat. Hello, everybody. Thank you all for coming.
Let me pop out that chat for you, Squid. Okay. I cannot increase the size.
I have my glasses on. You'd think I could see.
This is like watching grandparents chat. What
This is why we do podcasts.
This is why we do podcasts. Mm-hmm. This is
why. You all don't see all this part. Mm-hmm. We cut this out. So tomorrow, as many of you may already know, is July. Well, you probably all know tomorrow is July 1st. Although to be fair, you have a good reason for not knowing what month or date it is.
Do you know why that's special?
Well, two reasons. One that we have alluded to, which is tomorrow is the first day for new interns, new doctors who have graduated medical school but who have not yet begun to practice medicine to start July 1st, the official day. But on a personal note,
it's 14 years of wedded bliss for us.
It's also our anniversary.
Our anniversary, July 1st, 2006, as we said back in those days.
I was already in med school, so you'd think I would have realized that I had doomed us to anniversaries that would be very stressful and intense for a long time there.
You'd think that, but you would think you'd also doom us to an anniversary that we'd remember, because it's a very important day. It's one day we always talk about because it's wild to think that there are people who yesterday or today, as we're saying this, have not doctored at all.
No, they are doctors, but they have not doctored.
Doctored.
Yes.
And then tomorrow, they might be the one walking in the room, right?
It's important to remember that the people who are going to be doctoring for the first time tomorrow have trained for this for a long time and are continuing their education with the most supervision and the most ability to collaborate and ask questions and seek help that they will ever have in their career.
So they're like a razor that you just bought. And it's the sharpest it's ever going to be, like a Japanese flush trim saw that is as sharp as it's ever going to be.
This is going to be woodworking related now. Now we're going to get woodworking.
We're just talking about a Japanese trim saw. I used one for the first time today to cut a dowel off for your paper tray. Doesn't matter.
That's good.
So I shouldn't. Are you telling me? Okay, because what the joke that I've always heard since I've been around medical people, this still passes for a joke. Around July 1st, they're all like, hey, nobody gets sick, right? Nobody goes to the hospital.
No, I actually, I have to say, like, I know that a lot of times I'm supposed to be good natured. I think most people who are saying that aren't like really seriously saying like, no, interns don't know what they're doing. But it can rub you the wrong way, because there is this perception, having been a resident, I will tell you that there's a lot of confusion as to like, what are you? Are you a doctor yet? Do you know what you're doing? Do you have to like go get somebody to help you, or what's the deal? And sometimes I think those jokes add to that idea that as an intern, you might harm someone with a lack of knowledge or something. And the truth is that as an intern, all of the rest of us who are supervising you, we know you don't know how to do this stuff alone yet. Some of it you do. You know all the science. You learned all that. You've already learned all that. And you've practiced it. But it's going to be stressful doing it, for real the first time. And so we're all there to support you. And so interns aren't dangerous because they are being helped and supported and supervised the entire time. So there is no reason to fear going to the hospital in July any more than, nobody ever wants to go to the hospital any more than any other time, because if nothing else, this is the moment when the most brains are going to be thinking about you, like all at once, collaboratively.
Oh, what's that?
Well, because as you progress in your medical career, you need less and less supervision. So you're not going to have all of your supervising people necessarily watching every single move you make. But in the beginning, it is. I mean, I can say from experience that I did nothing without double checking and triple checking and quadruple checking with my seniors and my attendings and whatnot. And they were all very happy to help me because they knew I needed it. Yeah. And they wanted to do a good job. Do you remember when I started? Do you remember what it was like?
You were a little bit nervous, if I recall. As best I can remember, you were nervous.
Yeah. I mean, yes, I was nervous. I was terrified. I am a family medicine doctor, if I haven't said that. And as a family medicine resident, we have to rotate through all of the specialties during our first year. And if you're not in the medical field, if you're just here because you're interested, that's fine. Well, an intern is a first year resident. That's just the name we give to the first year resident.
We doctors are going to make you feel very comfortable. Oh, and I should also say trans rights, because I didn't say it before, and the chat won't let you go. They won't let you free.
Well, that's fine.
Until you
said
trans rights.
We could say
trans rights. Yeah. Obviously, trans rights.
Obviously.
It's obviously, I'm afraid to say it, but we shouldn't forget to say it. And I should just begin it should replace "Hey guys" on YouTube.
On YouTube.
Just right. Hey,
we didn't say "Hey guys."
Trans rights. This is just America. And just lead right in with it. That way, it's the most efficient, and it sets the tone. I think, because then everybody knows up front. Trans rights.
Well, you know where we're coming from,
and then you know where we're coming from. Yes.
And
yes,
so
Sydnee is wearing a Jeremy Bearimy shirt.
Yes.
That's the other thing everybody in the chat is talking about.
Oh, sorry. Yeah. I love that. We talked about getting a Jeremy Bearimy tattoo together. It's like a couple's tattoo, which
two tramp stamps, right? Yeah. Just spread across the both of us.
That term either.
I don't appreciate that term.
But no.
It's gendered out. I shouldn't have used it. I'm sorry.
Thank you. But also Jeremy Bearimy. Jeremy is a name. And although Bearimy, I think that's questionable, but Jeremy is a name. And if people know the show, then I would just have a Jeremy tattoo on me, which would seem odd since your name is Justin.
I could get it changed.
That's true. I don't know. We've debated it. Anyway, my first day of residency when I was an intern, I was on a general surgery rotation because you do that when you're in family medicine. So my first morning, I had to go and take care of surgical patients, mainly like post-surgical patients who were recovering in the hospital or like on the surgery service for different reasons. It was terrifying. It was terrifying. I don't think I slept all night. I always tell new interns this, the first order I wrote, and I literally wrote it because this was paper chart days. The first order I wrote in a chart as a doctor was for Colace, which is a stool softener, which you can buy over the counter, by the way. If you
break it down for non-medical stool softener makes you soft.
Yes, thank you.
I got a pill for that.
If you ever buy like generic stool softener, that's probably what you're buying. So I'm writing an order for an over-the-counter stool softener, and I sat there with that chart. I mean, it had to have been 15 solid minutes staring at it. I pulled out my little pocket med guide to double check the dose 5 times.
Can I ask you a question?
Uh-huh.
How come y'all prescribe over-the-counter stuff? I would just go in there and be like, you need pills to make your poopy softer. That will be $100, please.
Well, the patient was in the hospital.
Yeah. Well, when they leave, they need pills to make their poopy softer.
Well, yeah, but they also couldn't leave.
They needed it in the hospital.
They needed it in the hospital.
Whatever.
Also, sometimes if you prescribe things, their insurance will cover it and it's cheaper. That's a whole other issue. But anyway,
I get it.
The point is, I needed it in
deal.
the hospital. They needed it in the hospital, and so I had to write the order for it. And it took me 15 solid minutes. The nurse was actually standing there waiting for me to hand her the chart so she could put the order in so she could get the med for the patient. And I could see her just staring at me like,
Please.
What are you doing?
I'll get the poopy pills myself.
Because I was so intense, like, what if I order this stool softener wrong? But see,
And their poop got so soft that everyone was like, this is gross. It's not supposed to be like this. Who did this?
But that just illustrates this is what interns are going to be doing tomorrow. Nobody's in there like, I'm a doctor. I'm going to do it. I don't need supervision anymore. I am ready to do this. This is the mindset that I guarantee you all of these young interns have, which is, oh, dear God, now I have to write an order for a medicine. I'm going to take as long as I possibly can to do this so that I do it right.
Hey, whoever said that colitis overdosing is a real problem, nobody asked you, okay? I'm just trying a little fun.
Well, I can guarantee you the dose was right because I looked at it many times.
Well, apparently the soft poopy cops are in the chat and they'll let you know one or the other.
You should be careful with laxatives, especially. You should always take as directed and not take on a regular basis unless you've spoken with a doctor.
Okay.
That is true.
I won't.
But this was being ordered by a doctor. So
But
it was okay. It was appropriate.
okay.
A lot of times after surgery, patients are in pain. They need pain medication that can constipate you.
Gotcha.
Yeah. I spent a lot of time that month writing for stool softeners, pain medication.
You actually have to start with those when you're a beginning doctor tomorrow. Actually, to prepare people who are going in for their first day as a practicing physician tomorrow. There's like classes of medicine that you can write for. Your first few weeks, you're pretty much only going to be able to do stool softeners and like airborne, like stuff that doesn't do anything. Children's Tylenol, you'll be allowed to do.
This is not true.
And vitamin C supplements. Those are the only ones you'll get to. And then you graduate. You have to spend your insurance points, but eventually you graduate to like more powerful medicines. And then once you're like been doing it for 10 years,
This is not a thing.
they give you the secret medicines,
No.
the gold medicines,
Please
more
don't tell
powerful.
people this.
Okay.
This is not true.
Sorry, somebody doesn't want the dirt getting out, so I'll keep my mouth shut.
This is not
Shame on me.
true. Should we ask for questions? Does
Yeah.
anybody have any?
You can. I'm leaving to go.
You're
record.
leaving now?
I'm leaving to go record the Empty Bowl. But I love you.
I love you too.
Well, what time is it? 9:40. I can stay for a few
I was
minutes.
going to say, you can help me read the questions since
I was going to try.
my eyesight
I
is
was going to try to
letting me
clean the
down.
shop up too. All right, I'll read questions to you. You ready?
See if there are any questions. If you need advice for like if you're starting tomorrow.
I'll read all the questions. Sydney,
It's
you're
not medical
everything.
advice.
Um,
I'm not, but I appreciate that.
see. Is it random what rotation you end up on first, or is there a schedule?
Okay, so I had to go through all the specialties again because of family medicine. Not every single, depending on what you go into, you won't always have to do that. The schedule is, ahead of time. It's made by people in the department. And generally there's no rhyme or reason to who ends up on what first. I know that, at least you know, in retrospect, this was probably them just trying to make me feel better. They told me that they started me on a really hard specialty because they knew how strong I was. But I think that now that I think about that, that was probably not
Are you
true.
just realizing
I'm
this
just realizing this
right now in this moment? That's fun. Like when Griffin realized in a live show that we had been lying to him about the fettuccine in the containers at Olive Garden, that you're supposed to snack on those. You're realizing it right now on this live stream.
Yes. There was no way that's true. That was just so I wouldn't complain about being put on surgery when there were other residents who got like an outpatient rotation first.
Did I ever tell you that happened to my dad? One time he had this dog named, I think it was Shep or something like that. And he was talking about how much he loved this dog. And I said, so what happened to him? Like, you know, and Dad said, well, he was too big for our yard. And so he went to go live on a farm. My dog died. I watched it and realized, like, wait a minute. My dog died. My parents absolutely lied about it.
That's classic, though.
It's classic. Let's see. I start my 4th year EM rotation tomorrow. Any advice for how to make a good, I can't see the rest of that chat, but I'm going to go ahead and
something about impression. Probably.
Good impression.
The best thing, especially on your clinical rotation as a medical student, is just to be interested and like the people you're working with. Like I did family medicine because I really care about it. I'm very passionate about it. And I accept that all the students who work with me are not going to want to do family medicine. That's fine. I mean, not more people should. I wish more people did, but not everybody should because some people don't want to, and they should do what they want to do. But it's hard when I can sense that a student probably doesn't want to do family medicine and so therefore has no interest in it. And it's really, because I'm so passionate about it, it's hard to want to continue to like, well, let me show you this cool thing or teach you this really interesting thing if I'm not getting any interest. Mm-hmm. So like, I know it sounds cliche, but like just showing interest in the stuff that the, you know, attendings and residents are telling you about is really important. Just asking some questions, being enthusiastic. When we say something like, hey, do you want to go see this in this room? This could be cool. Say yes. I mean, unless, you know, you've got to go to the bathroom or something. Like, you'd be shocked how many times I'll be like, oh, this is a really interesting thing that would be good for you to see because you don't get to see this a lot. And a student might say like, oh, no, that's okay. And I'm always like, oh, okay, really? Well, I mean, you might not see that for years or ever in your career, but okay, that's fine. I mean, I'm not going to make people have those experiences, but just honestly showing like interest, enthusiasm, asking questions, that's really the number one thing I look for. Not knowing the answers, I'm never worried about that. We can teach you that stuff. It's having the passion for learning things. And even if it's not necessarily what you want to do, learning about something you don't know about, that is the thing I look for. Everything else we can teach. Somebody asked if it was ever worthwhile to ask for a real doctor over an intern. The thing to know is, well, one, an intern is a doctor. They have their degree. They have completed medical school. They cannot start as an intern unless they're a doctor. So they are a real doctor. Now, as far as if you mean like someone who has more training, an attending physician, the intern is being supervised. They have to be. They're being supervised usually directly by a senior resident who has already been through a couple years of training and is closer to graduating. And that the whole team is being overseen by an attending physician who is done with their training.
Can you describe what that is? You're doing that now. You do that now. So can you talk about that process?
So usually in the hospital, I lead our inpatient, not all the time, but when I'm on, I lead our inpatient family medicine service of doctors. And what that means is when a patient comes into the ER and needs to be admitted, the first person to come in the room will usually either be an intern or a second-year resident, so someone who's more junior. They will come in and they're going to ask you a bunch of questions and take your, do a physical exam on you and kind of tell you what the plan is. And then immediately after they leave the room, they're coming to talk to the rest of the team If it's in the daytime, they're probably talking to the whole team, to all of the juniors, seniors, the attending. They're telling everybody else what's going on. Everyone's putting their heads together, formulating a plan. And generally speaking, the more senior resident and the attending will probably be coming to see you shortly thereafter. Now, if it's in the middle of the night, as the attending, I'm at home. So I will not be there physically, but I will be on the phone talking to either directly to the intern or junior, or sometimes through the senior, depending on where, the order of operations, who's doing what. But I'll be discussing your case the whole time. And then I will see you as soon as I get there the next morning. So everything that is being done, the point of contact for you will be probably the intern or junior first, but it's all being discussed with a senior resident and an attending at all times. So especially early on, every move that you make when you first start out is being discussed. You don't put in an order, you don't put in a diet order, you don't put in a Tylenol without talking to somebody about it in the beginning. So, and you will see your attending. Your attending will be in the room.
Candace wants to know what your second choice would have been for specialty if you hadn't gone into family.
I initially wanted to do infectious disease medicine. I was really fascinated by that. And I guess I almost did that. But my only fear as I went through all the different rotations,
There's germs.
No, I
She's
wasn't
afraid of germs.
I was afraid I'd get bored, which seems like a wild thing to say right now.
Especially now.
I know.
She thought she'd be bored.
I know this.
We have another one coming behind that. Oh,
don't start a flu panic. I didn't. I mean, who could predict this? I really thought from my rotations, because I shadowed infectious disease physicians, and they were remarkable and smart and cool. And I mean, it was very interesting, but I wanted to know about all the other stuff. And so I would talk to the patient about whatever they were there for, their hepatitis or whatever the ID doctor was seeing them for. And then I would want to know about, their diabetes or about their blood pressure, or I'd want to talk to them about their family or their social situation. And I always wanted to get into all this other stuff that was not the specialty. And I finally realized I did my family medicine rotation last. And sometimes you just fit somewhere. And in medicine, you're lucky if you find that, because not everybody always knows right away. But when I got to that rotation, it just clicked. I looked around me at the other physicians in the room, and they thought like me, and they talked to people like me, and they were interested in the things I was interested in. And
so was that?
Fit, just clicked.
All right, now I'm actually going to record.
I'm going to try to read questions.
Everyone be nice. I wish there was a way to make this, here, go ahead and get into position. I want to see if there's a way to make this chat. Oh, you're so cute, having to lean in like that.
Well, everybody's talking about Ohio.
Yeah, it's the OHI, you know how people do.
That's a thing people do. See, we're in West Virginia.
This won't work. Okay, I'm just going to do this. You're not going to be able to see yourself, but that's fine, right? Is this good?
Yeah, I don't need to see myself.
I'm sorry. Is this the best? This is a Zoom button? Is that Zoom? Nothing's, oh my God, I'm 85 years old. Okay.
You're going to accidentally give me a back.
Turn you a hot dog. I want to enjoy my wife, please. That sounded,
That was very old. I won't know how to stop this, but I'll figure it out at some point. Would your third choice be geriatrics? I do. Sorry, Justin's changing his shirt off camera. I do love geriatrics, but I'll be honest. I really I wanted to feel like I could take care of anybody who walked in the room at all times, and not that you couldn't as a geriatrician, because you usually do. I mean, I have a lot of colleagues in family medicine who went on to do geriatrics or internal medicine, so obviously you can. But the longer you spend, I think, just doing one thing, the harder it would be to do everything else, right? Like when I started my career, I was delivering babies. I haven't delivered babies in a long time. It would probably be hard for me to do that now. And I want to be able to do everything all the time, no matter who walked in the door. So I do love geriatrics. I have all the respect in the world for geriatricians, but I don't know. I think, ER would have been another good fit for me, because you get to see such a variety of things in emergency medicine. that would have been fun too. But I just fit in family medicine. Sometimes you just know, if you're in medical school, really look for that. When you look around and go, these are my people. Family medicine were my people. Let's see. I have a friend who's planning on going into pediatric medicine. Do you have advice for her? Pediatrics, that was another world where I really liked working on my pediatric rotation. I really liked the people. I felt close to them too. Taking care of kids is great. It can be a little harder because they can't always verbalize to you, right, exactly what's happening. I mean, they can tell you how they're feeling, but they can't always express it as clearly as an adult can, especially the younger they are. So it's a little more challenging in that way. I think the main thing is to, it's always important, especially once kids can start to, once they can understand, to make sure that you're including kids as much as possible. Like I always try to talk to the kids who are old enough to be involved and start, I really like adolescence and getting into teenage years, and start trying to empower them to think about their own healthcare and to take charge of their own health. Because I think that's something we don't always do enough of, not pediatricians, but as parents, is to hey, this is the moment where you've got to start thinking about your own health. Because someday I'm not going to be coming to the doctor with you, and you're going to need to worry about and care about and prioritize these things on your own. And I really love those conversations with kids. And so that's one of the main things I would say, is start thinking about, as kids get older, how you involve them in that and give them that kind of that sense of responsibility and this is something I can do. I can help take care of myself. I can think about my health, and I can advocate for myself. And it's a really empowering thing you can do for kids that I think will benefit them their whole life, even when they're adults. Let's see. Any advice for rising second years who are going to be upper levels for the very first time? Do you mean second year? Oh, second year residents. For a second, I thought you meant med students. The main thing is when you start supervising, just remember this is a very embarrassing story from when I was an intern. No one was harmed. I always want to preface, no one was harmed. I just looked, I looked silly. But I say this because I think my best advice is don't take anything for granted. Don't assume, no matter how competent and confident and how great their grades or board scores were, your intern, just double check things. Really encourage them to feel comfortable asking you any questions. That's the number one thing I try to, even as an attending, I will look at my seniors and say, I want you to know that I will never get upset if you call me. You call me 30 times a night, wake me up every 10 seconds. If that is what you need to do to take care of your patients and feel safe, then you do it. And I'm never going to be mad that you call me. I will be mad if you needed my help and you didn't call and then something happens. That would make me mad because I've made it so clear that I'm here and I'm available and I don't mind. So if you're supervising as a second year resident, that is one of the main things I'd say, is try to get that relation, make sure your interns know that about you, so that they can ask you, no matter how silly the questions are. My silly story, when I was an intern really early, maybe my first day even, it was my first or second day. Again, I'm on general surgery. That service can be so busy. I don't know how they do it. Surgeons, I don't know how you do it. And I was rounding all these patients, running around, running from room to room, trying to write all my notes, handwrite all my notes, and write all my orders, and see all my patients before rounds, which had to happen before surgeries could start, which was really early in the morning. So, it's super early. And one of the nurses stopped me on one of the floors and said, hey, could you transition all these patients' meds from PO by mouth to IV really fast, because they're going to have surgery and they can't have anything to eat or drink, but they also can't take pills, and all of their meds are by pills, and they've got a dozen of them, and could you just switch all these to IV? And again, I had not written very many orders, and I really knew all the mechanism of action and stuff. If you wanted the pharmacology of all these medicines, I could tell you about them. I knew what they were for. I knew what they did. But when it came to things does it come IV. I didn't necessarily know all of that yet. So I look at her and say, so you just want me to switch them from pills to IV? Mm-hmm, yeah. Okay. So I write some orders, some of which are fine, others of which are things like a cholesterol medicine IV or a Claritin IV. Very silly orders, which the nice thing to remember if you are about to work in a hospital is that there are lots of safeguards. Well, one, those medicines don't exist. So nobody was going to accidentally get those medicines. They're not real. But two, as soon as the nurse entered those into the chart, into the computer, I actually got a page, and I looked at my page, didn't recognize the number, called the number back, and it was the pharmacist. And the pharmacist said, "Is this Dr. McElroy?" "Yes. How can I help you?" Are you an intern?" "Yes. How did you know?" "Where are you?" I told him, "I'm on 4 North." "Hey, can I come sit with you and talk with you briefly about medicines?" So the pharmacist came and found me and set me down and went through all my orders with me. It was very kind. Not at all arrogant. Did not make me feel. I did feel silly, but not because of the pharmacist, because of my own ridiculous orders, and walked me through this whole thing. And I never made those mistakes again, because then I knew to consult my little book, not just for like, what's the appropriate antibiotic here? What's the right dose of this medicine? I also knew to check, like, does it come IV? So don't take any, and again, they thought I was, or they told me that I was a strong intern. But that's why, right? That's why we have so many levels of people double checking and triple checking. And the pharmacist knew from that order, hey, maybe this intern needs a little extra guidance. And I got it. And I didn't make that mistake again. But hospitals are full of people who are supposed to catch that stuff. So yes, it was a lovely pharmacist. I have been lucky to encounter so many helpful pharmacists. Boy, that's a good tip if you're going into, if you're going to be a doctor. Get to know your pharmacist in your hospital. Get to know the pharmacist in your community. Because even today, I was doing some telemedicine, and I wasn't sure about a certain medication, like insurance payment and which one would be covered. And I wanted to make sure that this would all work. So I just called the pharmacist at the pharmacy that I was going to be working with, and just said, hey, can you talk me through this? And we went through some different options and came together to a medicine that would be covered, so the patient could afford it and would work and would be appropriate. And take advantage of that if you're going to be a doctor, because that really, pharmacists, in my experience, are always very happy to help you out and give you advice and not make you feel silly. And they appreciate you recognizing their expertise and reaching out for help. So somebody says they're going into FM and they love the outpatient setting, but they're worried about the inpatient. I love inpatient medicine. I loved it it was hard. I'm not going to sit here and say it was all rainbows. It's hard inpatient medicine during training. This is very variable. Our family medicine inpatient service is very rigorous. It's always the word we use. You want to say busy because that sounds intimidating. It's a very rigorous experience. We have we admit a lot of patients, and that's not always true for family medicine inpatient service. But we were kind of one of the first residency programs in our particular med school. And so we were one of the most robust early on. And so we took on a lot of patients early on before all of the other services existed. And we still do that to this day. And we believe very strongly in our program in preparing, if you are interested in doing inpatient medicine in your career, preparing residents to be doctors who can do that very well. Because not everybody does, right? A lot of people do outpatient medicine. I loved it. This is going to sound weird. I loved being on call. I loved being in the hospital. I loved being the one I knew it was a limited experience, and it was good that it was, because I couldn't do it forever. Especially now, I get tired now. I feel like I never got tired back then, but I get tired now. I loved being the one in the room in the middle of the night, helping to figure out the problem, come up with the plan, and being the first point of contact for somebody to say, I'm here, I'm listening, we can figure this out, we will get you better, you're in good hands, we can do this. I really treasured that experience. And so for me, I loved inpatient medicine, and that's why I still do it. That's why that's the brunt of what I do today is actually inpatient medicine. All of my outpatient medicine now has moved to one of our local shelters that serve our population facing homelessness, Harmony House. All of my outpatient medicine now is there. It's all volunteer. So inpatient is still it's like the brunt of my job in medicine these days. So I loved it, but I know it's not for everybody. Let's see. Is that CJ in the background? No. That is actually Amelia. Amelia is our kitty that we got how many years ago? 7 years ago, I want to say, hereabouts. Yeah, that sounds right. Our kitty CJ passed away last year. It was the beginning of this year. Oh my gosh, all the time is running together. Our kitty CJ passed away a few months back, and we miss her very much. We had her since before we got married, since before we had the girls. She was our first girl. So that is our other kitty, Amelia, though. She's still grieving. We're working on it. If anyone has any tips on that and could let us know. We're trying all of the things we keep reading about because she's having a rough time with it. She's also this is a total sidetrack. This has nothing to do with medicine. She, I believe, is part feral. She was a rescue, and as soon as we because she was sick when we first got her, once we got her all better, took her to the vet a few times, and she was doing better. We haven't really been able to hold her or touch her since. She's not mean at all. Never seen her claws, never bitten anybody, nothing like that. Just like runs from us all the time. I keep trying though. Especially now, I keep trying. She's let me just barely pet her a few times, and then she runs again. So I'm working on it, but it's been hard for her because CJ was her buddy. So let's see. So somebody asked, as a young adult who's new going to the doctor and handling my health by myself, what's the best way to advocate for myself despite not really know what I'm talking about? That's a really good question. And it's hard because the impetus is really on us as the medical profession to be better about listening and hearing our patients. And I think the medical system needs to be structured better so that patients are given the time they need, because nobody is given the time that they need to talk about all the things they need to talk about in our current system. It's part of my problem with, I was always behind when I was working in the clinic. I think the number one thing is to not be afraid. First of all, whatever your most important question is, make sure you get to ask it, because it can be hard as a physician. Like when someone comes in, if they're following up on chronic things, I'll have certain things in my head that I want to make sure I get to. Like I got to make sure I ask them about this and about this and about this, because we haven't checked this in a while. We haven't checked this. So it's always important to think about agendas. And I try to think about that on my end too. I have an agenda because I know about you and things that I want to do. Or even if we haven't met yet, I know I want to get your history and I want to do this and I want to make sure you're up to date on these screenings, and because of your age and this, these are things I need to look at. So no matter what it is, there's a certain agenda in my head. But that doesn't always mean that it's the agenda in your head as the patient, right? Like you have your own fears and concerns and worries and questions that you came to a doctor with. And it's most, I hope most of us will listen when a patient starts to tell us, without using those words necessarily, I know you have a different agenda, but my agenda right now is this. And all that other stuff that you're talking about, it's not that it's not important, but it's not what I'm here for today. And so I think the easiest way to say it is, hopefully, usually, the first thing I'll say is there anything in particular you want to talk about before I launch into my agenda? And think before you go about if you have a big question, if you have a big issue, if there's a big thing that you want to make sure you get to, don't be afraid to say that. Don't be afraid to say, yeah, there is. I have this, and this is my big question and my big worry and my big fear and the big thing I want to address. Because what that sometimes signals to me is, you know what, maybe I need to put some of this other stuff on the back burner for the moment, and we can focus on this together. And I'll schedule you to come back soon, and then I'll talk about these other, health maintenance recommendations that I want to make sure we get to because they are important. But right now, they're not the most important thing. And it's hard because sometimes I won't realize that a patient had a question or a concern. We call it the hand on the doorknob question, until literally I'm about to leave the room, and I'll have my hand on the doorknob and they'll say, actually, there's one more thing. And that is almost always, I always tell medical students this, that is almost always the most important thing, is the hand on the doorknob question. And in a better interaction where the patient feels better cared for and I feel like I've done a better job, we can get to that question before my hand's on the doorknob, because that's what the brunt of the appointment should have been about, right? Not whatever else I came up with. So don't be afraid to come with your question and put it out front first, and advocate for yourself, whatever that is. And because that is the thing, if it's your biggest worry, then it should be my biggest worry. Or if it's not a big worry, then my number one job should be to help reassure you so you know why. So don't be afraid to put that out there. Don't wait for the hand on the doorknob. Or, if you do, still ask it. But you prioritize your time in that appointment the way you know you need to. And then your doctor can always reschedule you for the other stuff, because there's always going to be stuff they want to cover. And they can bring you back for that later. But don't be afraid to put that out there right in front. I'm a standardized patient for my college's medical department. Do you have any advice for making things as realistic as possible? That's a cool question. I used to work with our clinical skills department and help with organizing those exams for students. As standardized patients, to make things realistic, I think the number one thing is don't, med students are going to hate me for this, don't give them the answers too quick. Make sure you're a little, like real patients are usually kind of worried, and aren't they're not necessarily going to, as soon as you ask the right, give you a series, are you having nausea? And no, I am not having any nausea or abdominal pain or diarrhea or whatever. And sometimes standardized patients are so they're trying to help you along. But in a real visit, patients aren't always just going to list off all the symptoms you want them to right away. So don't be afraid to put a little bit of acting into it. You came because you're sick or you're worried about something or whatever, and you can put that in there. I always appreciated that. I always thought that was a good experience for students. It throws them a little bit at first, but they need to feel that way because that's how it's going to be. So don't be afraid to, don't feel silly about hamming it up a little bit. I loved when I could get standardized patients to do that. It was hard to. Somebody asked about how to pick a residency program. It's hard for me to say that in general because my experience both applying to and interviewing applicants for is in family medicine, because I'm in an academic program, so I've also been on the interviewing side of this. The number one thing, again, I would say, I know there's this nebulous idea of a place that suits you. In my interviews, I didn't interview many places because I kind of knew I wanted to stay at my home program. It was like, I mean, you want to make sure that they have the things you want. I knew that I could pursue my interest in inpatient medicine there. I did a global health track through my residency program where they sent me abroad a couple times, and they sent me to a tropical medicine course through the military. And I'm not in the military, but I got to go as a civilian. But I knew I wanted those things, so I wanted a program that had those. So like, it's really easy to narrow them down just by, do they have the things that I want to pursue? Do you want to do a lot of OB? Do you want to do sports medicine? Do you want to do, these are all very family medicine specific, but make sure whatever specialty you're going into, that if there are certain areas of that specialty that you like, that you find programs that have that, because nobody has everything, but you know, you'll find it in multiple places. And then when you interview, really get a sense for how the residents feel. There was a program that almost won me over in Cincinnati. That was a wonderful family medicine program. And what really sold me on it, the program director was great. My interviews were great. All that was fine. I mean, I got no complaints about anything with the details of the program. But what really sold me on it were the residents. The residents were happy. They were having fun. They seemed really pleased with their choice and like happy to be together. And you could tell they were really like enjoying the whole thing of like being residents and being there and interviewing new people and answering questions about their program. And Justin and I had to have a long conversation because he was also invited to dinner, and they were so welcoming to him too. Anyway, look for that. Look for residents that look like they're happy to be talking to you about their program. Because if they really don't want to talk about their program or they don't seem too thrilled about it, it's usually a bad sign. I hope our residents are like that. Because I also found that at my home program. But that was number one. Let's see. Thoughts on telemedicine? Telemedicine is so hard. Full disclosure, it's hard for me to get really passionate about any of the billing issues when it comes to medicine. I think if you listen to the show, you probably know that I am fully in support of single payer healthcare. And so I'm not going to get into the weeds about billing issues, and all the medicine that I do outpatient right now is volunteer. I don't get paid for anyway. So I can't speak to the billing part. I know that that's been a problem for people. The thing for me that has been the most challenging is that I believe that the physical exam is fundamental in medicine in two ways. One, the obvious, it helps you figure out what's going on, right? And I think that those skills never go out of style. And the kind of medicine I do a lot nowadays, I don't have access to a lot of labs and imaging and all the stuff that makes medicine a little easier. I don't have access to that, and so the physical exam for me is tantamount. The other thing though is that I feel like it's really important to connect with your patient, to have that moment where I'm like listening to their heart and lungs and examining for their lymph nodes and looking down their throat and looking in their ears and like making that human contact. I feel like for a lot of patients, that's really important to feel like I am their doctor now, and we have that relationship where we can move forward to try to like help them with their medical care together. And I really feel that lacking in the care I'm providing right now. Like, I mean, I don't think that you do harm with it. I think you can do medicine this way, certainly for the most part. I think you can accurately diagnose things and treat things this way. But that connection is missing for me. And I think probably patients would say the same thing. So it is what we must do right now. I'm not against us using telemedicine right now. I think that it is vital, and I'm glad we live in an age where we can do it. But I very much look forward to seeing my patients eye to eye in person again, and doing the physical exam and feeling like we're connecting like that. Somebody asked, what made me choose Huntington? I was born here, actually. I was born in Huntington, and then my dad at the time worked for the railroad. If you are a railroad family or know any railroad families, you move a lot. We moved all over the place and ended up back here when I was like 10, and I've been here ever since. So, and I don't know. We just never left. Justin and I talked about it a lot, and we like it here. We love Huntington. We love being close to our family. We like raising our kids here. So, and I got lucky because they had a really great family medicine program. What else am I? Oh, it's a local question. Members of staff at Marshall Ortho have tested positive for COVID-19. I know. I have heard about this. My niece was there 14 days ago. Should she get tested? My understanding, and please know I am not part of that department, and so I don't know the particulars firsthand. Everything I know is from the news, but what has been reported by Marshall Orthopedics is that no patients were exposed. So that is so if she was there as a patient, my understanding is that there was no exposure to any patients. That is all I know, though. I'm not going to tell anybody not to get tested if they're concerned, but this is what has been said, that no patients need to be concerned. Hopefully contact tracers are calling everybody that's been exposed. That's the way it's supposed to work, is that if you had been exposed to COVID somewhere and you didn't know about it, you should be getting a call from the health department. That applies everywhere, all over the world. Is it happening? I don't know. I'm sorry, I'm having trouble understanding some of the questions. Is there a graceful way to tell a patient that you need to leave the room and switch to an N95 because you think they might have COVID? I don't know if there is, but I think that the thing we're all going to have to do moving forward is allow for, this is awkward and weird because this is not what we normally have to do. But we're all going to have to allow each other to do things that are sometimes awkward because it's for our safety. I don't know, everybody's protocol is different. What we've been trying to do is screen for any symptoms of COVID before you even make it to an exam room, because we have a testing tent outside of our facility where if anybody has any concern at all, they're supposed to be tested there. They're not supposed to come in for appointments. So they're not supposed to make it to the exam room. Now, I know nothing is perfect, and so that you may have the exact same setup and people are still making it back, but I think you just have to be honest and say, hey, before we go any further, you've said a few things that concern me. I need to change out my mask before we continue the conversation so that I can continue to provide you with care in a responsible way. I mean, you got to stay healthy too. And I think people know that now. I think there's been enough clear messaging about the importance of healthcare workers and the importance of PPE and the need to protect our healthcare workers. I hope people are understanding of that. Michael Sullivan, was it weird to have friends as patients? Michael Sullivan's my friend. That's why he's asking me that. Nah, I don't know. Justin says I click into doctor mode when I'm being somebody's doctor. And he says I do it with him sometimes when he starts asking me about medical stuff. He really likes it. Justin always liked that, like when I was in medical school and I had to practice doing the physical exam. It was very like ASMR for him. Like, please, like, yes, you can do the physical exam. It's not weird, guys. He felt very cared for by it. And so he said I go into a whole other mode, and I think that's probably true. I am my doctor, and who is, I am her doctor, she is my doctor. We're very good friends, and we do that to each other. And I see her click into doctor mode when I'm asking her questions at appointments, and she does the same. I know I do the same to her, and I don't know. I like it. I think it's fun. I think it's kind of nice. I've never felt weird about seeing friends, or like, I mean, where I live in a city, but it's kind of a small town. And so I have taken care of a lot of people who are friends or not family, because you shouldn't take care of your own family, but like friends of the family or people I grew up with, or like teachers. So I kind of like it. I always wanted to be that kind of doctor. Let's see. How often would you Babinski, Justin? A Babinski reflex, if you've ever had it done, is when, I'm not going to show you my foot. Somebody takes a reflex hammer and runs it up the bottom of your foot, looking to see what your toes do. It's one of your basic reflexes. It feels really weird. Justin was not a huge fan of that, but he did like the neurological exam in general, because the neurological exam involves a lot of like very specific things that you're asking the patient to do, and like touching the patient in very specific way. He always really loved the neurological exam. I don't know. Do doctors really make the worst patients? I would say we do. I would say I would not just restrict that to doctors. I would say probably a lot of us in the medical world do not make great patients. I don't want to speak for everybody. I know I'm a bad patient. I know I am. The only time I have been very lucky in my life that I have not had to be in the hospital more than when I was having both my children. Well, when I was very young, but I barely remember that. As an adult, just when I had both of my children. And I know, I'm sure that if any of the nurses who took care of me were here, they would say I was a bad patient. I just want to get out of there. I don't like people taking care of me. I know that's a weird thing to say. I really don't. I'm very independent. I don't like people doing things for me. I don't like to feel like people are catering to me. I get really, I don't know. It's a problem I have. It's a problem because I'm not good at asking for help when I need it. And Justin has helped me be a lot better about that, but I know I'm a bad patient. How do you think this will impact the future of medical education? I have been impressed. At our medical school, they obviously the students couldn't be present for a while for their concern for their own safety. Students are being reintegrated back into all of our levels of, hospital and outpatient and all that stuff now. I know that though, even on telemedicine, the students were participating, at least in our department, and I assume in other departments this was the truth. We're participating in telemedicine visits, which is wild to think about, but we got the technology for it, so why not? And, I think more and more we need to think about ways, not just when there is a pandemic, but medicine could be more accessible to everybody all the time. All of the world could be more accessible to everybody all the time. And I think that seeing how easy it is for some things to be done on telemedicine, because it really is. Some things are very, very easy to do that way. I think it's revealing that the world has the capability to be so much more accessible all the time for everybody, and it's just not. Hopefully that will be a good change. So I think medical students will be fine. I think it is important that we're getting them back out there into the hospitals and into the offices as safely as we can, though, because I'm very strongly believe this applies to medical students, although I think I hear this rhetoric usually used for physicians and nurses and people already in, like, working their healthcare jobs, not in training. Like the hero narrative, that we're heroes, and so we're out there risking our lives. We shouldn't be, right? We should have PPE, and we should be able to go in and take care of patients with COVID and protect ourselves appropriately while doing so. It shouldn't be something that you have to put your life on the line to do. When I am on hospital service now, I use my hospital, thank goodness, currently we have not been overwhelmed. And so I have all the PPE I need. So I do not feel like I'm putting my life at risk. And this goes doubly for medical students who are not getting paid, who are paying to be there. So I think we have to protect medical students right now while giving them the education that they need. And I really think that the students now will be fine. I think that hopefully other medical schools have been as creative and innovative as I've seen ours be to try to face this problem and still make sure everybody's getting the education they need. And hopefully this will be short-lived in the grand scheme of things. Is it awkward working on a sawbones or been band buffering fan as a patient? You know, it has happened so rarely. No, this might sound weird to say. Most people don't really know about that here. Occasionally I'll have colleagues ask me like, how's that radio thing you do going? I don't have, I've had a few, and most of the time people are pretty low key about it. And they're like, at the end, they'll be like, by the way, I like sawbones, you know, which is always very nice. Like for me, it's just like, oh, I don't hear that day to day. So I always really like, it's very nice. It means a lot to me. I don't feel awkward. I feel very grateful for it. But most people, it almost never happens. So I don't know. People in Huntington just don't listen to a lot of podcasts overall. Some do, but most don't. Let's see. Hey, Sydney, what is one piece of advice you would give to someone who wants to be a doctor today? I think the one piece of advice. I have so much advice. I don't mean to sound, you know what I mean. There's just so many things. There's so many things to think about. There are, other than being a parent, there has been nothing more rewarding in my life than being a doctor. The times that I feel like I have really been able to make a difference in someone's life, it's so humbling and makes you feel so much like, at least for me, like I found my place in the world. Like I'm where I'm supposed to be and doing the thing I'm supposed to do in this moment, which feels really nice in such a world of uncertainty and change, constant change. So my one piece of advice is don't forget why you're doing it. You can get really, I don't know if this is true all over, but our medical system is so damaging for so many people in it, both patients and caregivers, because it tries to make you care about the wrong things. It tries to make you care about RVUs and billing and like how fast you can see patients and how quickly you can do things and how many procedures you can do and all this stuff. There's so much pressure from people who aren't actual caregivers to try to make you think all this stuff matters, that after a while you can get really jaded and forget why you ever did it, because you're just lost in a sea of like boxes you have to check and numbers and quotas that you're supposed to be meeting and things. I think it really helps if you are able to do anything like any of the volunteer work that I've done, and now that I'm able to do a lot of that, really helps me to recenter why I went into medicine and not just want to run away from the whole thing. Because I think this is something that I meant to say if anybody is going into residency. In residency, we talk about, at least in our program, one of my senior residents when I was an intern looked at me one time in January, so the middle of my intern year, and I was having a really rough time, and I was sitting in the call room crying, And he came over and he patted me on the shoulder and he said, "Doing okay?" I said, "I'm okay. I'm just, just everything. Just hard, tired, hungry, miss my family, overwhelmed, everything." And he said, "It's okay. These are the crying times. You're going to have them and you'll get through them. And if you want to talk, I'm here, but they'll pass." And I passed that along to my interns when I was one of the chiefs, the crying times. And that is something that happens. Definitely you hit a point in your residency where you have the crying times. And you question, why did I do this? Why would I ever want to do this? What else can I do with my degree? Is there anything else I can do other than be a doctor? And they pass and you feel better and you remember why you did it. But those times I think happen throughout medicine where you have another period of the crying times. And it's important at those times to remember like why you did it. Always remember why you wanted to do it in the first place. And if you're not a doctor, if you're thinking about going to med school and you can't answer a question why you want to do it, think about it longer first because you got to have that answer in the back of your head to be able to keep going, or otherwise you'll get jaded and bitter, and then that's bad for you and it's bad for the people you take care of, and you don't want to get in that situation. How do you help a loved one grieve while taking care of yourself? That's a good question. I always think of it as kind of like a chain of care. When I hope, I know he would say that I was there for Justin when he lost his mom. A lot of my ability to be there for him and support him, I think was bolstered by the fact that like I had my parents and Taylor, and Riley was a lot younger than, but Taylor to lean on. When you have, I always like to explain it that way to people, like you got to kind of have a chain of help. I can just be there for you because I have this person behind me who's holding me up and they've got somebody holding them up. I think that really helps. I don't know if that is helpful advice, but that is what helped me. I think that's gone both ways for me and Justin through our relationship. We've been on both sides of that. How do residents and medical students financially support themselves? So you get paid in residency. It is a paid training position. It's like an apprenticeship. So you get a salary and you're also in training. I think it's like most things. Is that enough to support you? For where I live, it was plenty Justin was working too. And we were married by then. So we both had money coming in, but it was plenty for Huntington, which is not an expensive place to live in the grand scheme of things. But you do get paid. Some residents choose to moonlight to help make extra money. Once you have your own license in residency, you can do that, which is like you're not in your training program, you're like working at something else like urgent care or something for extra money, extra hours. You can do that as well. But that's hard. People did that. I know. I did not personally do that because it was everything I could do just to do residency. But you can do that to make extra money, but it's really hard to fit that in and not work too many hours a week because we're restricted on that. We can only work 80 hours a week, averaged over 4 weeks, which can be a lot. In med school, loans. You can work in med school. It is possible, but again, it's really hard. It's really hard. That's why people start in so much debt in part. Med school is very expensive, right? And then also you can have a job while you're in med school, but it's a huge challenge. And the people who do it, I think that's super impressive if you can do that because it consumed me when I was in medical school. I did not much else. And I lived on loans and overdrew a credit card. So I don't recommend that. Um, let's see. I love mask questions. How do you get your parents to wear a mask while shopping? I'm lucky that all the people in my immediate reach, my family and friends, are all fully in support of mask wearing. The only thing I see a lot is a lot of rhetoric about, like, I'm not afraid of getting sick, or I'm not going to wear a mask because I know they won't keep me from getting sick. And I don't know. I'm going to try to give people the benefit of the doubt. I don't know if everybody knows that it's not so much for you that you wear a mask, but for other people. I feel like that messaging, and I think people are certainly trying to get it out there, but I feel like that could be said more. It's not about you being scared. It's not about you thinking you will or won't get sick. It's about protecting other people. And I don't know. I feel like that selling point, and if that doesn't work, I don't know what else to say. But I try to say, I try that with people a lot. Like, that's fine that you're not scared, but other people are. And it's a way of showing you care about other people. Let's see. What other questions we have? What quality is needed to be both a professional and a political activist? I don't know. I guess I am those things. I cause a lot of trouble at work, so I guess I'm a professional. I don't know exactly in what sense you mean. I would say you can't be afraid to make others uncomfortable. That might be an important quality. I realized pretty quickly that I had a deeper need to say the things that I felt were right and needed to be said than to have others like me. And living where we live, and in the medicine can be a more conservative profession. I don't think, I mean, certainly there are people like me in medicine, but I would say a lot of my colleagues are more conservative, and aren't really used to, like, making a lot of waves. And so I had to make peace with having people not always like me, or not think I'm a team player. And I'm okay with that if I feel like it's for the right reasons. I mean, not just because I want things the way I want them, but like if I see something that I think is wrong or unfair, I will say that. And I think that's the number one thing. You've gotta be okay with people not always liking you as much afterwards, which is hard. Let's see. How do you talk to an 8-year-old about COVID and protests and Black Lives Matter? I don't know. I've been talking to my almost 6-year-old. I say 5-year-old. Charlie's almost 6. I've been talking to her about them. So I feel like that's applicable. I've been very open. I'm maybe too. I don't know. I'm very open with I say the kids, but Cooper is 2.5. She doesn't, I think, understand a lot of what I'm talking to her about, but I tell her. I've been very open about everything. I don't want them to be scared when it comes to the COVID, when it comes to the virus. I've said because we're pretty strict about, we don't go anywhere. The grocery store when necessary. We get groceries delivered as much as possible. I go to work when I need to. I do telemedicine a lot, so I don't go to work much. Obviously, Justin works from home, and we stay here, which they're used to traveling a lot, so they weren't thrilled about. But they understand that we're staying here largely to protect other people, and my parents live right down the street, and they're also being as strict about isolating and social distancing as we are. So they've been in our like isolation pod the whole time. And so a lot of what I explain is we're doing this to protect Mimi and Pop. We can keep seeing Mimi and Pop because we don't go to the park and play with other kids, and we don't go to the mall, we don't go to movie theaters, and we don't go to restaurants because all that's open here now. And I think that helped because then it wasn't so much like, do I need to be scared that I'm going to get sick? It was more, you're protecting other people. So I think that really helped in terms of COVID. We've been talking a lot, Charlie and I, about the protests. There are a lot of great books you can buy if you want to, if that's something you're interested in. I'll have to put out a list. Well, I mean, there are better lists than I could put together. But I've been reading some books about how to talk to your kids, especially about being anti-racist. I've shown Charlie footage of the protests and explained to her why and what's going on. We drove by the protest that was happening here in Huntington. I was very nervous about the social distancing aspects of it, so we like drove by and like honked and waved and supported from our car from a safe distance. So we were part of it without being physically close to other people. And I explained to her why we support this and why we are part of it, why this is important. There are a lot of great children's books. I've been trying to diversify our reading list. So I don't know. I feel like kids are going to understand a lot of what's going on, whether or not you talk to them about it. So you may as well start talking to them about it. And one of the books I'm reading, How to Raise White Kids, makes the point, which I think is very poignant, that almost all Black children are being raised talking about race because it is essential that their parents talk to them about race from a young age. And a big part of the problem is that we're not doing that with white kids. We're not talking to them about these issues so that they can be anti-racist. And so I'm a big advocate of that. Justin came back, but he doesn't want to join us. Let's see. What do you think this coming school year will look like? Justin can tell you I've been obsessing and worrying about this constantly. I think it's going to be different everywhere because they're leaving a lot of it up to individual school boards. So I think every single place is going to do their own thing. Here they've got like 3 different models they're kicking around. I think there are probably going to be places. I don't think anything's going to open up. I don't think any schools will go completely like they would have last year. I don't think. My hope is that there will be masks and an attempt to limit class size, maybe with like an alternating schedule or something. I think that they have to provide the option for distance learning. Here in West Virginia, there's so many kids that live with their grandparents. I think you would have to. I don't know. I think it's not really a medical answer. The AAP has made it clear their stance, the American Academy of Pediatrics, that schools do need to reopen, but they need to do it in a safe way. I think the problem is like we've never put enough of our resources and money into helping schools do all the things that they could do. So, okay. Okay. Well, I've been on here a while. I know. Let me see. I'll see if there are any more questions. No, it's not. Nobody else's fault. I'm enjoying chatting. I just don't know how to stop it.
You don't know how to stop it, so you have to keep doing it.
So yes. Oh, I'm a family medicine doctor. I'm a medical
press
doctor.
that red button when you're done.
Press the red button. Oh, there it is. Justin just wants to go play a video game. That's why he's not coming here. I'm trying to think, I don't know if I have a more embarrassing doctor moment than when I wrote for Simvastatin IV. That was pretty embarrassing. Yeah, I mean, that was way up there. Luckily, it's been better since then. I don't know what video game are you playing, Justin? I think he's playing, hey, Justin.
Yeah.
Are you still playing that zombie game?
Last of Us Part 2, yes.
Last of Us Part 2 is what he's playing. So, I don't know. Let's see. Oh, that's hard. Do I have any advice for people living with someone not taking COVID seriously? I don't know. I mean, you know, I feel like all the graphs and numbers, the chart looks so bad, you know, in the US right now. I don't know how to, if you that
Hey, don't be too much longer. I miss you.
Okay. If that doesn't convince people, I don't know. It's hard. I don't know what else will I mean, it's really, I feel like until people see it firsthand, like either in themselves or somebody they love, some people just aren't grasping it. I don't know how to, the altruism thing is my best pitch for people. It's not just about you. Wouldn't you feel terrible if you brought something home to like your grandparent or something? What is Justin? Justin really likes that game he's playing, Last of Us. He likes it a lot. But it's really scaring him. He has yelled several times. Let's see, any more questions? Anything else? How do I have so much energy? Oh, I don't know. I think that's one of the secrets of doing residency. You just get this ability to like turn off your need for sleep for a while. And then eventually this is still a skill I have. When I can sleep, I can fall asleep instantly. I have almost never, I mean, there's a rare night where I'm worried about something, like the night before I started an internship, where I might not be able to fall asleep. But for the most part, anywhere, anytime, I mean, all the lights on, noise blaring, on the floor, in my clothes, no blanket. I can sleep anywhere. There's the greatest skill you will learn in residency. You can fall asleep anywhere at any time. If it is time to sleep, you can sleep. And you can go from sleep to awake and ready to like run to a patient's room frantically in a split second. That is, I think, a skill I still have. I can't bring the kitty here. Amelia won't let me pick her up or move her. She'll run from me. I could chase her around for you, but that would not be very nice. I don't know. She's been that way since we've had her. But she's sweet. She's never hurt anybody. She just won't let us touch her. Let's see. The number one best piece of advice for learners you've ever received. I'll talk about the best advice I've got in general, and then for tomorrow before I go. I was very nervous about not. I guess this may have been some imposter syndrome. I kept thinking as I ascended through my levels of education that at some point somebody would figure out that I wasn't really deserving of being there. I kept waiting for somebody to like catch me, somebody to walk in and go, aha, there you are. We knew you were here all along. Get out of here. You don't belong here. And I that's mostly gone away now. But because of that, when I started as an intern, I was so worried that people would, especially in my program, because they were so excited to have me, because I looked good on paper. And so they were really excited to have me. And I really wanted to live up to their expectations. And I was so worried that if I asked a question that was really simple or obvious, that I would disappoint them, that I would let people down. I wasn't worried about like getting yelled at or ridiculed as much. I mean, I didn't want to, but like, I really didn't want to let people down. And what I realized pretty quickly, when faced with, ooh, okay, I don't know how to manage this medical issue. And the next thought was, and if I don't ask somebody, someone's going to get hurt. And so I asked the question. And I was very lucky because, and this is no shade on surgeons, but surgeons are not always known for being warm and fuzzy. If you're a surgeon, you know it's true. In family medicine, we're very warm and fuzzy. In surgery, they're not always. But I was very lucky to have a surgery senior who told me after answering my question, please ask the questions. You'll never learn if you don't ask. This is the time where you're supposed to ask. By the time you get to be a third-year resident, by the time you're an attending, if you haven't asked these questions and you don't know the answers, then it's a problem. But when you're an intern and you're asking the questions, we expect that. And so I asked, and I asked questions, and I never, I mean, I can't think of a time where maybe somebody thought poorly of me because I asked a question that they thought I should have known. But nobody ever said anything to me. Because what resulted is that every time I asked a question, I learned something new, and the next time I didn't have to ask it, and I could take better care of somebody. So, I mean, the number one thing is do not be afraid to ask questions. I am never worried about the student or the resident who says, I don't know, can I ask a question? I'm not sure. And I mean, sometimes I might say, you know what, that's actually a really good thing for you to go read about, like to a student, like go read about that topic, and then you can tell me about it later. I hated that as a student too, I know, but it's a good learning experience. As a resident, usually you answer the question because they need to know to take care of the patient, and then they can read about it later. But I'm never upset about that. What worries me more is the intern who doesn't ask any questions, because I know you got them. I know they're in there. They have to be. You can't know everything. You can't know everything, and so ask the questions. Nobody's gonna get mad because you wanted to do a good job, and so you asked a question. At some point, if you're asking the same question over and over and over again, at some point it's concerning, because then it's like, maybe this is an area you need to read about a little more. But in the beginning, this is your moment to ask all the questions, to double check everything, to go say, can I follow you on that procedure so I learn how to do it better? Can I come with you to see that kind of patient because I've never seen that rash or whatever before? This is the moment to do that. Take full advantage. You are a learner. We want you to be a learner your whole life, but this is the moment where the more enthusiasm you have, the more you're going to gain. And really, as an educator, as a faculty member, as someone who grades, I mean, not literally, but you know what I mean, who gives evaluations, residents who are eager and enthusiastic always get great marks from me and more encouragement from me, even if it's because they're asking me a million questions. I don't mind. That's what I'm there for. And people love knowing stuff. You love to answer questions. People love feeling smart. So make your attendings feel smart. Make your seniors feel smart. Ask them a ton of questions. Most of us want to share that info. So that's the best thing. That's the best thing that I would tell people to do. Tomorrow, when you show up, take a deep breath. Ask all the questions you need to ask. Ask the nurses. Ask the nurses know so much stuff that they are happy to tell you if you ask them, especially because you're showing that you respect what they do and you respect the knowledge they have. So ask your nurses, ask your pharmacists, ask your respiratory therapist, ask your physical therapist, ask your occupational therapist, ask everybody. There are so many other, ask your social workers. Become best friends with your social workers. Oh my gosh, social workers are the MVPs of the hospital. Ask all of these people questions. Ask your lab, oh my gosh, call the lab and ask to come look at a slide. If you want to be best friends with a pathologist or a lab tech for the rest of your life, ask to come visit the lab and look at something down there. I did that a few times, and they are so excited to share that with you. Ask the radiologist to come look at films with them. The radiologist used to scare me until I knocked on the door and said, can I come look at something with you? And they love that. They love that. Show that you are interested and you care, and you're all in it together. You're a whole team of people with different professions and interests and jobs and skills that are taking care of other humans. And that feels amazing when you're part of it, and take advantage of all those resources that you have and partner with all those people that are around you. And then the stuff that everybody will tell you: pee when you can, eat when you can, drink water. I can't tell you how many times I would come home from a call shift and think, I can't remember the last time I peed. My kidneys are shutting down. Drink water. I will say sleep when you can, but if you're like me, I couldn't sleep on call. Every time I tried to, it just, I knew the phone would ring. But try. Listen and listen to your patients. Take the time with your patients. Don't let the time limits, these artificial limits we put on appointments, don't let that dictate how much time your patient actually gets. Don't let that rule your life. So few problems can be crammed into 15 minutes. They're out there. There will be the occasional visit that really takes 15 minutes. But those are few and far between in my personal experience. Give the patient the time they need, and listen to them. Listen to what they're telling you. Because again, that hand on the door question, it is on us to try to stop that from being the hand on the door knob question and to being the question that you talked about the whole appointment, so that the patient feels like they got the answers they needed and the care they needed at that time. And then you can do the other stuff at another time. There can always, if you've created that relationship, then there will be a next appointment. If you haven't, then maybe you never get a chance to really help somebody, and that's a lost opportunity. Wear a camel pack. Yeah. Drink water. I think a lot of this, you say somebody asked any advice for a new nurse. A lot of this, I think, goes the same for nurses, especially the like self-care part, like eat when you can, drink when you can, sit when you can, protect those times where you can like take a moment for yourself. Never be afraid to ask. You're all part of a team. Nobody should talk down to anybody. This goes for nursing, new nurses or nursing students or new residents. That's not a learning environment. New seniors, don't make your interns feel bad. Don't talk down. It's not a hierarchy. We're a team. Everyone has a role to play. We're a team. I say that and it sounds cliche, but I mean that. I have never pulled the I'm an attending, so just do what I say card. Because it is disrespectful to the level of training that whoever I'm talking to has achieved. And it is not the way I wanted to be treated. And that culture in medicine helps no one. It does not help the people practicing. It doesn't help the people we're caring for. I think that's all I've got. I think that's oh no, you just asked me pre-med student, any tips for getting into med school? I used to be on an admissions committee. You got to have all the big things right, like decent MCAT scores and decent grades. You just got to have those things. The other things I would say that you can't read in a book, or you can, but might not be as obvious. In your interview, have a clear idea of like, again, why, and not just we all want to help people. Really, why? Why this, though? There are lots of ways you can help people. Think about that, because when you go for your interview, you really want to know why. Why this particular way of helping other humans? And I like science is not really the best answer either. I do like science. I love science. It may be the truth, but it's not the best answer to that question. That, and then have some vague idea, even if my parents weren't doctors. I didn't have like somebody telling me what all my options were in medicine. A lot of the reason I wanted to go into medicine was because of books I'd read. But I kind of knew at the time, I thought I wanted to be an ID doctor. So I talked about, I wanted to go into infectious disease, and here was why, and here was kind of the stuff I wanted to do. So I showed that like, I'd actually kind of, because I had investigated what it meant to be a doctor. I'd actually, at that point, I had found an ID doctor in the community and rounded with him a few times as a pre-med student so that I could get a feel for it. Showing that you have that level of interest really speaks to people. That is one thing that I don't think was always made clear in pre-med days, is like showing that I've pursued it enough that I've read about it and I have some vague idea what it looks like, as opposed to just, I don't know, whatever a doctor is, I guess I want to be that. So think about that. I think that's everything I've got. Then, I mean, you know, Scrubs is pretty much real. That's not true. Scrubs has lots of problems. There are parts of Scrubs that are a lot more like Residency. There are parts of the book House of God that are a lot like Residency, and then parts that thankfully are not, that are exaggerated nowadays. But you'll read it and you'll connect to it if you're in medicine at some point, and there's a reason. And I'm going to go. So thank you all for being here. Thank you for all your questions. If you are starting tomorrow, good luck. You're going to be great. You're going to do wonderful. All you have to do is just ask questions. Ask questions. This is your moment to ask every question you've ever wanted to ask, and don't be afraid. Because when it's July next year July, this time next year, we're going to expect you to know some of those answers. So ask them now. And everybody keep wearing your mask and social distancing and washing your hands and staying at home as much as you can and protecting yourself if you've got to go out into the world. And I think that, and protesters, protect yourselves too. Keep wearing those masks. Our protesters, everybody's been so good. Everybody's wearing those masks, and it's just amazing. Keep up the good work. And thank you. Good night, everybody.